Diabetic foot is a common name which is given to an infection in a diabetic patient. The infection usually involves the foot of the patient. The foot is involved because it's in direct contact with the earth and it is subject to injury. The injury can occur because of decreased sensation in the foot. Any crack, any prick or any injury to the foot should not be ignored, as the sugar levels in the body are high. There is a decreased protective sensation in the foot because of peripheral neuropathy, which usually accompanies a diabetic patient. This infection, if neglected, can lead to increased tissue destruction. The tissue destruction which occurs in a diabetic is extensive. In the presence of peripheral vascular disease, peripheral neuropathy, and uncontrolled blood sugars, the infection causes extensive damage to the foot, often leading to amputations. If the patient arrives in time, if a proper surgical management is done, lot of these foots which can undergo amputations can be saved. We are very competent in doing microvascular surgeries to save such foots. Such foots, if preserved, help in increasing the longevity of the patient, increasing the self-confidence of the patient, increasing the overall. Studies have shown that if the foot is preserved, then the overall lifespan of the patient also improves. See, normal fasting sugar levels are supposed to be less than 100. If not up to 110, it's permissible. But in a diabetic, what happens is that these fasting sugar levels, they are raised. They may go beyond 140 is what is defined as a diabetic. Pre-diabetic is 110 to 140. Whenever the fasting levels are between 110 to 140, we usually consider them as pre-diabetics. And once it's beyond 140, we consider them as diabetics only. Diabetes is a mother of all diseases. That's in a way true, because it affects all the systems in the body. It affects the vessels, it affects the nerves, it affects the kidneys, it affects the heart, it affects the brain, it affects the eyes. So one has to be very particular that diabetic sugar levels are controlled, and they are always checked constantly, and they are properly monitored. If the sugar levels are monitored, it goes in a long way in preventing the complications which occur in diabetes. You can delay the onset of complications and enjoy a healthier life by controlling blood sugar levels.